So we're a really broad group of services. There's about 150 of us who work in pharmacy, and our main focus is obviously to get to the patient the safest possible medicine at the right time.
So we have two roles. We have supply, which is the main thing that people think of, that pharmacy, that's where we get our medicines from. But we also have the safety element. So there's lots of parts to the safety element. It's about keeping the patient safe, which is the most important thing to us. It's about keeping the staff safe, so making sure that their procedures are correct, but also they're working in a safe manner.
So our clinical pharmacists and medicines management technicians on the wards support this by making sure that patient's medicine is safe at the point of admission right through to discharge, to make sure it's the safest possible dose and choice of drug, and to make sure that they've got the right medicines for when they go home and that they understand what they're taking. The EPMA system, which is the electronic prescribing medicine administration system, is being rolled out throughout the whole of the hospital. It's on medical patients at the moment, and we're going to be rolling it out to all patients throughout the trust in time. It's what that does, that enables the doctors to be able to safely prescribe, because there are prompts for them so that they have to choose certain medicines. It means the nurses can read, because they don't have to have complications with doctors' handwriting, and doses will be the correct doses. We can also transpose medicines from previous admissions, so we've got a list of what the patients were on before, so that will help as well. It also speeds up the discharge process as well, which improves the flow for the patient.
We've been putting in these lovely electronic drug cupboards, which make things quicker. They help us with our stock control, so that we're not running out of things in the wards, and the nurses are not having to spend time ordering things. Things are done automatically for them. So lots of exciting things that are happening in pharmacy, but that impact everybody in the hospital.
The benefit to the patient for the extension of the service is more medication histories are completed, so we know what the patient was taking prior to admission, and we can then give the GPs a more complete information for when those weekend patients are eventually discharged.
So the new role in A&E looks at trying to get the patients as safe as possible, as quick as possible. So getting those medication issues sorted out as quickly as they're in the door, trying to get that done then, so that they're not missing medications that might, if they're diabetic, if they're epileptic, if they've got Parkinson's, missing those crucial medications might actually mean that they stay in hospital longer because they become unwell because they've missed medications. If we can sort that out quicker, then it minimises their length of stay in the hospital, and we can just concentrate on why they've come into the hospital in the first place rather than adding to any issues.
The majority of patients will have had their prescription charts screened by a pharmacist throughout their stay, and we pick up on all sorts of things, whether it's medicines that weren't prescribed on admission just because they weren't known about, or whether doses weren't quite right, or whether things that have been withheld because the patient's condition merited it, then needed to be restarted on discharge. And we'll have had input at all those different points of the patient's care, whether or not they were particularly aware of it. Well, really, we'd really like to have complete integration within the clinical team to ensure that every patient has the opportunity to see a pharmacist, either at an outpatient appointment or through their admissions in the hospital, right through to their discharge.